She is a 21-year-old collegiate soccer player. She's doing everything that they do, running and practicing and lifting weights, and there's nothing she can't do. And then the next week, she can barely walk, she's crying, she's having a hard time sleeping, can't bend, and her world's pretty much falling apart. And she goes to all these surgeons and doctors, and their answer was basically, be patient, live with it, you'll get better. And if you don't get better, then you probably just have to live with it because you're not a good candidate for surgery. She's been active, healthy, fit her entire life, and in her freshman year of college, everything's going just great. Then all of a sudden she has this really bizarre accident working out in the gym for soccer. Over time, she lost the ability to run because it was just too painful. Going to class was difficult because she couldn't sit the whole time and found herself standing in the back of the room just to get some relief. All those symptoms were totally new to her and almost out of body. So what did she do? Somehow, some way she ended up in my office, and all these symptoms that she was describing sounded very, very similar to disc-related back pain. And we tried a bunch of different things, and really, because the last thing we wanted to do was do surgery on her. But in her mind, she's running out of options, she's running out of therapies, and how am I going to live the rest of my life like this? And she was committed to getting a solution. If the non-surgical therapies aren't working, you're left with two options: fuse it or replace it. The long-term consequences of fusion are that you high likelihood of needing another fusion, and that's just not something that I would accept, not for me and not for my patients. So ultimately she ended up undergoing a disc replacement surgery, and it was very, very successful for her. She's back to college, she's not hurting in her back anymore, and she's increasing her activity daily.